Good evening and welcome to our Plumas County Public Health hosted virtual forum on COVID. We're going to get started here in just a minute. We're going to let anybody else who's going to be popping in there to let them in. So please hold tight for the next minute to minute and a half and we'll get going. All right, well, here we go. Again, my name is Zachary Gately, and I'm with Plumas County Public Health. I'm the Public Information Officer for our agency. So I answer a lot of the questions that come in, whether regarded to COVID or otherwise. Tonight, we're going to be hosting a virtual forum for COVID-19 to answer questions of the community, where we're going, to cover some treatments and maybe just look at some different aspects that are throughout the county that keep continually coming up. We wanted this to be an open platform for the entire county, hence why it is virtual. Otherwise, we would have loved to do it in person, but we were very cognizant of people's times, especially with focusing on the evening time frame so that people could get there after work. So just wanted to clarify that we're not worried about COVID in this type of forum, and that's not why we're doing this virtually, rather to give people throughout the county the chance rather than being very Quincy centric. So first, we're going to go over just some quick housekeeping items as we go through. Melody, are you on board? I don't believe so. So I'll go over those housekeeping really quick. During our first initial questions, there's going to be about 30 minutes that we're going to be going over the questions that you guys have so graciously submitted. So thank you very much for that. During this time, you will be muted. And if you have questions, we'd ask that you put them in the chat or utilize the reactions at the top of your screen for raising your hand. After those 30 minutes of answering the questions, we'll have about 15 minutes or so left that will go over a live Q&A type of thing based on the order of those that have raised their hands or put their questions in the chat. During this time, we're wanting to provide information for Plumas County specifically. And so we're going to ask that you really keep away from anything, very theoretical, very much at the federal level, very much out of our hands. We cannot make those decisions and we cannot answer those questions. However, we'd love for you to ask questions in regards to being in Plumas County, COVID, and what that means if maybe you or a loved one got COVID or what you'd like to do to prevent that or how that affects your children in school. So really keep that in mind as we go. We are going to ask that you keep your question to a question and not a statement. That means that your question should be no longer than 1 minute long. If you go over 1 minute long and there's no question associated with your statement, then we will move on. So just wanted to put that out there. We really thank you for coming to this. It's been something we've been wanting to do for a while and just finally been able to have the bandwidth to be able to do it. So with that, I'd like to introduce our panelists. First, we have Dr. Dana Loomis, who has been our Director of Public Health here in Plumas County for nearly a year. He's been with the agency for about 2 years, first volunteering his epidemiology skills, and then after that working part-time while he was still working at UNR. Dr. Loomis completed his PhD at University of North Carolina, Chapel Hill in epidemiology, as well as has a Master of Science in Public Health from Chapel Hill too in environmental studies. Dr. Loomis most recently worked at the University of Nevada, Reno as a professor in the School of Public Health, whereas prior he worked with the World Health Organization in Lyon, France, as well as held a number of other academic positions, including chair of the Department of Epidemiology at the University of Nebraska Medical Center and the director of the School of Community Health and Sciences at the University of Reno. Dr. Loomis has frequented Plumas County since childhood and relocated here in 2018 after his tenure at Lyon. He is also an EMT and volunteers on his local fire department, so we've been really happy to have him on board in that capacity. We also have here Dr. Barnes, Dr. Erin Barnes, focuses on adult and pediatric medicine, as well as obstetrics and gynecology. She is a member of the American Academy of Family Practice and is a board-certified family medicine doctor. She gained her medical degree from the University of Kansas School of Medicine in Kansas City and completed her residency at Sutter Health Family Medicine in Sacramento. Her hobbies include hiking, mountain biking, cooking, and spending time with her family. And she's originally from Kansas, however, has lived in California for quite some time now. We also have Dr. Satterfield, who is our health officer here in Plumas County. He went into medicine because he really liked the country living, and he noticed that there was a shortage of good doctors out in the rural area. So he attended medical school at UC San Francisco, followed by a fellowship with UCLA in family medicine in Ventura. He's been a family doctor here in town. He was a family doctor here in town for 6 years, more than 20 years in emergency medicine, and most recently, as I mentioned, is our health officer. So he has a big passion for preventative medicine, which is why he is our health officer. But not only that, he really likes that balance with personal choice, stating we have the right to risk harming ourselves, but not to endanger the health or lives of others. He is passionate about playing the saxophone in his spare time and deeply enjoys time with his family. Now, unfortunately for Kevin Bean here as one of our presenters as well, I did not get a chance to get his bio. So Kevin, would you mind introducing yourself briefly?
Sure. My name's Kevin Bean, and I'm the Associate Superintendent of Student Services for Plumas Unified School District, Plumas County Office of Education. I've been working in Plumas County for the district now for about 3.5 years. And during that time, I've worked closely with our school nurses, and since I was working closely with them when COVID came up, we're a small district with lots of roles, and so my role rapidly moved into helping out with our COVID response in the district. And so I've been meeting weekly with Dr. Satterfield, Dr. Loomis for, I guess it's been about the past 18 months, and along with our superintendent, Terry Ostrike, who I just extend her regrets that she was unable to come tonight due to some unforeseen circumstances. And so, but she and I work closely together on all these things with the doctors, and with Zach at Public Health and Serena at Public Health. And so my interests include, besides work, dogs. I love my dogs. I love to spend time with my family, with my wife and I and the dogs, and travel a bit. And that's kind of me. So.
Great. Thank you very much, Kevin. Without further ado then, now that you've introduced us, or now that we've introduced ourselves, I'd like to get into the questions that have been submitted and kind of direct that a little bit. So first, just to start this off, Dana, this question is going to be for you. I'd like you to explain, we've had a number of questions that have come in regards to how do we know this is a pandemic on the level of severity? We've seen a lot of things change over these past 2 years, especially specifically with the different variants that have come out, and we've seen a lot of our regulations change. So, a lot of community members are very concerned with this, and why is it changing, and how do we know we're in a pandemic? And if you could shed some light on that, that'd be very much appreciated.
Thanks, I'd be happy to do that. And I'm going to start out showing a slide. I just have a couple of these. I hope you can see that now. So, one of the ways that we know we were in a pandemic that's really hard to argue with is that we can count deaths. And, the fact of death is kind of hard to argue with, and it's well documented pretty much everywhere in the world, as opposed to the cause of death. So this slide that you're seeing here shows data from the United States that shows total deaths from 2018 through basically this month. And if you look at the graph, you'll see there's an orange line that kind of goes up and down. And over on the left-hand side of the graph, those upswings occur in January typically, and they're due to seasonal variation in mortality. But on the right side, what you'll see is that the blue bars, which are monthly death numbers, all of a sudden start to go up over that orange line. The orange line is kind of the average of what you would expect for mortality. And all of a sudden, look at that, in 2020, we start seeing way more deaths. And there are some distinct peaks there. So in January of 2021 and 22, the numbers get really high. And in fact, we see this around the world. I can advance the slide. Let's see. Sorry about that. I have two screens here. So this slide shows data from a bunch of other countries, and you can see that same kind of peakiness to mortality. So again, this is total death. And the reason that's important is that, we can count deaths much more easily than we can find the cause of death. Determining the cause of death determines some medical information, and it's not very well documented around the world. And then this brings us to where we are now. So more than 500 million, that's 500 million confirmed cases of COVID as of today, and 6 million deaths around the world. So, we've had almost 1 million deaths just in the United States. And so, these are kind of hard statistics that are hard to argue with. And they demonstrate pretty convincingly that we are in a pandemic that is really unusual in terms of the numbers of deaths that are occurring. So the other question that Zach asked is, why do things keep changing? We have all these different guidances and pieces of advice and rules. And I would say that there are three reasons for that. The first reason is that the virus keeps changing. Just remember 2 years ago, this is a virus that nobody had ever seen before. Nobody was immune to it. We didn't know anything about how it was transmitted really, and we didn't know how to treat people who got sick with it. And so, that virus went from being brand new to being kind of well known over the course of the first year of the pandemic. But the virus was also changing during that entire time. Viruses are always evolving. And so those changes first gave us Delta, then they gave us Omicron. And it's likely there will be other variants coming. So the virus is one reason that things keep changing. The second one is the science, of course. As I said, when this virus first came on the scene, we didn't know anything about it. And we've learned a lot over time. And it turns out that some of the things we thought in the beginning weren't right. For example, in the first months of the pandemic, people spent a lot of time cleaning surfaces. We know now that's not very important, so we don't advise doing that anymore. And then the third thing that's changed is the population. So again, in the beginning, nobody had any immunity to this disease. Now a lot of people have been infected. There's some immunity from that, and there's immunity from vaccines. And so we keep needing to change our advice as the virus, the science, and the people change over time.
Great, thank you for that. This question is going to be open to whoever would like to answer. We want to talk a little bit on preparedness. We've had some questions of what can you do to be prepared in case there is a new wave or a new variant?
Well, I'll take a quick first stab, and I'm sure there may be other follow-ups. But number one that pops in my mind is vaccinate. The vaccines have shown themselves to be amazingly safe, and they're not perfect. And we're all a little disappointed that they're not 100% protective of even cases, but they're still working remarkably well to keep people out of the hospital and to prevent deaths in basically all age groups. So the best way to prepare for the next surge, which is likely to come at some point, is to get vaccinated. And I can pass the baton to the next respondent.
So speaking on vaccines, though, we've recently had a new approval of a second booster dose. Now, this is only to a specific group of people. Can you explain that a little bit of what decision was made or what that means for people who would fall into those groups?
Well, the best data is coming out of Israel, but around the world, it's been clear that the immunity from our vaccines does tend to wane over time. And so that when, many months, 6 months, or up to a year passed after a person's fully vaccinated, it's clear they're not quite as immune as they used to be. And that lack of immunity translates, I'm sorry, but it translates into deaths, and ICU hospitalizations. And so it's really clear, not only do we want to help the individuals. So yeah, the first booster dose was approved. Now the second booster dose is a little more controversial, but we clearly think certain people are good candidates, but it's not so simple for the government to just draw a line and say everybody over 50 should have it and everybody under 50 not. We really respect people's not only personal preference, but right to help make those decisions themselves. So there are a little bit pros and cons, but certainly people that are going to be in a riskier situation, let's say they're going to take an international trip where they're going to a country that's not as well vaccinated, that would be a reason. Or maybe they have some what we call comorbidities, like maybe they have asthma or COPD, or maybe they've had heart troubles. Those are people that would definitely be more likely to benefit. So we think it's really a personal choice, and it's a matter of what risk people want to take. On the flip side of that coin is we really think everybody should be fully vaccinated. That means 2 doses of an mRNA vaccine plus the first booster. And a little different with J&J, but because it's protective, and especially people over 50 or 60.
Great, thank you, Dr. Satterfield. So now, kind of to piggyback off of that, and so this would be for you, Dr. Satterfield, or you, Dr. Barnes, but people who are vaccinated, we're still seeing them get COVID. And so that's been a concern for a lot of people who have held off on getting vaccines until maybe the approval from the FDA. And now that they're seeing that people are still getting COVID. So what gives?
Sure, I can take this one. Can you guys hear me okay? I feel like there's a delay on my video. Okay.
Perfect.
So yes, absolutely. You can still get COVID if you're vaccinated. But I can tell you just from the clinical side, from working here in the clinic, as well as a hospitalist at our hospital here, that in general, we're not seeing people who are vaccinated get very sick. So of all the COVID cases I've taken care of in our hospital here, I would say 99% have been unvaccinated. So people who are vaccinated seem to be protected from severe disease and just have a fairly mild illness. Not to say you're not still sick and feel yucky, but seem to be protected from needing to be admitted to the hospital, needing oxygen, things like that.
Yeah, I'll jump in, with that too, and to say that I think all of us in the health professions and scientists are disappointed that they're not 100% effective. And right out of the gate, it looked like they were going to really knock 90+% of the infections out, and they're not that good. But I'm a fan of analogies, and I like to think about car seats for kids, seatbelts, airbags. There's no guarantee just because you have an airbag that you're going to survive a bad crash. And in some ways it's a similar thing, and we don't think twice. We know our kid needs to be in a car seat. We know we want to put on our seatbelt if we're going down the canyon. And I would say the vaccination is similar to that. So if there's somebody gets a little sicker and they're vaccinated, we have to say it's not perfect. But on the other hand, we know that airbags and car seats save lots of lives and lots of morbidity, and it's similar to the vaccine in that way.
So Dr. Barnes, quick question. Can you get a booster at PDH?
To be honest, I'm not totally sure what we're doing in the clinic right now. I'm sorry.
That's okay.
I'll tell you what I'm telling my patients though, is that I'm recommending that my patients go to Rite Aid or Quincy Pharmacy or to Public Health to get their boosters. It seems to be the easiest way. My family, we got our boosters at the pharmacy, or our shots at the pharmacy, and it just seems to be a little bit easier. We were doing some shot clinics here, and we may still be doing them, but you do need an appointment. So you can't just walk into the hospital or to the clinic and get your booster or COVID vaccination at this point.
And health officer, where else can somebody get a booster? Anywhere else in the county?
Well, yeah, that pretty much captures it, but I agree. The pharmacy is by far the smoothest place. Now, our clinic at Public Health does the third shot for people because that's basically to be fully vaccinated, you need that. I'm talking about the mRNA vaccines now. But we don't routinely give the fourth one because there's still questions about, who really qualifies the most. So we like to refer those folks to talk to their primary provider about getting it. And then if you have a note from your primary provider, we're glad to give it. But we really do like to have a person's provider weigh in and help us with that decision making about, are you immune suppressed? Do you have a good reason to get a fourth shot? Because it is a bit controversial still, despite the approval that it has from FDA and CDC.
Yes, so at this point, all hospitals and all pharmacies are giving both the initial vaccine doses as well as the boosters. And as Dr. Satterfield clarified, Public Health is doing the same, with the exception that if you only qualify for the fourth dose or second booster based on your immunocompromised state, not your age, then we'd ask that you visit your primary health care provider or your specialist at that point. But the clinic here at Public Health does do all the other of the initial and the first booster dose, as well as the second booster dose for anyone over the age of 50. So thank you guys for that.
Yeah.
So now we've had a couple questions come in. Now we're talking about vaccines, of course. And now the topic of children and vaccines has come up. So how important is it for children to be vaccinated?
Well, others may want to comment, and Dr. Barnes may jump in here too. I think it's a less clear cut that children get the COVID vaccine than it is for things like measles, mumps, and rubella, where we know the morbidity is high and the vaccines are extraordinarily effective. On the other hand, children get this thing called multisystem inflammatory disease of children. And it's pretty clear that children also are subject to long COVID syndrome. If you've read and heard about that, it's a very gnarly, pardon the term, problem for a lot of people. And it seems to be very real. And there may be mental components and heart-related components and lots of components we don't fully understand. And there's getting to be more and more evidence that children get this stuff too. So what I say about children and vaccines is we have amazingly safe vaccines. There is essentially no recorded cases of really bad things happening to kids on account of the vaccine. And on the other hand, some kids do die of COVID, and some of them get this MISC syndrome. And we don't know if they take the virus home, they may pass it to grandma who has comorbidities. So I think there are numerous reasons to get it and very few risks to getting it, and it benefits our society as a whole too, probably. Any thoughts on that, Erin? Or
yeah, I agree. From a public health standpoint and transmission standpoint, it definitely makes sense for kids to be vaccinated because they definitely transmit the virus. We know that. Yeah, in terms of severe disease, I feel like it's a little bit harder because we in general are not seeing children have severe disease, thank goodness. So yeah, I think I've had a lot of conversations with parents about it, and I certainly don't have a very hard line about it. Like, oh, I think your child has to be vaccinated. So I think it's a good thing, a good conversation to have with your family doctor. And for teenagers, I do think it's a little bit different. Like, we definitely have seen teenagers getting, as you get, they get a little bit older, getting sicker for sure. And I do feel like in that teenage age group, vaccination is really important. I feel like the evidence is a little bit less clear for the 5 to 11 age group. And again, not a safety concern, just they don't seem to be getting very sick from COVID.
I love to jump on that with the issue about myocarditis too. There's 2 points about myocarditis. One is it's a great example of how great the VAERS system works, where we report out adverse effects that might be associated with vaccines, and that's also how the blood clotting was discovered with the J&J vaccine, was that the VAERS system really works. People report these things and people look into it and they say, look what's happening. But with myocarditis, it's interesting, these 16 to 20-year-old males are the most at risk, but the cases seem to resolve much more quickly than the routine cases of myocarditis that somebody might get that's not vaccine related. And furthermore, the risk is 10 times or so more if you get COVID that you might get myocarditis than if you've it's due to the vaccine. So it's remarkable. We're kind of focusing on the donut, the hole rather than the donut here. The bigger risk is COVID. It really isn't the vaccine.
Yeah, my understanding is that the risk, when they looked at all the data, the risk of myocarditis infection in children from COVID is higher than the risk of myocarditis from the vaccine. And again, this is an extremely rare complication.
Definitely so, yeah.
Well, thank you guys very much for that explanation. I think that really helped. But one more thing, kind of just last part about this with looking at COVID and how it kind of cycles through and the importance of vaccine. A lot of people have asked, well, it seems that we're headed more toward a flu-like, very mild type of symptoms. So why should I even get vaccinated if it's getting less?
Well, I'll jump in on that too, unless someone else has something they'd like to. Maybe if somebody wants to pick up on what I say, Well, first of all, it is widely believed that the virus is getting less and less virulent in the sense of less and less dangerous. But quite honestly, there's really no scientific foundation for that. Viruses mutate, and this one likes to mutate. And the next version, the next surge may not be better, or it may not be milder, it may be worse. And so that's one of the points there. And, when things become endemic, like an endemic virus, like influenza is, they aren't necessarily milder. So we have to be cautious. There's so much we don't know. And at this particular point, I think caution is the word. And there may be a time we understand this virus and its tendencies even better. And it may become milder, but we're not there yet.
And I'm starting to see on the clinical side, people with long COVID, with sequela of COVID infection. So I certainly recommend vaccination for sure. Like Dr. Satterfield says, we just don't know what's coming with more variants that are certain to come at some point.
Well, I'd like to pick up on part of that question too, because we hear a lot about COVID becoming endemic, especially from politicians. But as Dr. Satterfield said, that doesn't mean it's not dangerous. Think about malaria. Malaria kills almost 1 million people a year in the world. Malaria is an endemic disease. HIV really has become endemic, but it's still a very dangerous disease. And so endemic doesn't mean that we don't need to be concerned about it. It means really to epidemiologists that the occurrence of the disease is kind of predictable, like influenza, for example. It's not entirely clear that influenza is endemic, but the point about influenza is that it happens in predictable cycles. It moves from the southern hemisphere to the northern, and every year in the northern hemisphere we get this winter peak of influenza. That's not where we are with COVID yet. We're still have many more cases of COVID than we do of influenza, and its comings and goings are kind of unpredictable so far. So we're not really at the point where it's an endemic disease yet.
Great. Thank you guys for that explanation. That was really helpful. You answered the questions, I feel like, very well for what was asked. Now, just to take a quick step back, we were talking about children and vaccines. So let's pivot a little bit. And I'd like to direct this question toward Kevin. Can you explain a little bit what the local schools are doing to prevent COVID from spreading now? There's been some recent changes, and from last year being mostly virtual, and now here we are in the classroom pretty much all year. Do you mind covering that a little bit, Kevin?
Sure. So, back at the beginning of this year, we definitely were following all the guidance. We continue to follow all the guidance and work with you guys at Public Health to make sure we're doing that. So we were masking. Obviously, we were early in the pandemic. We were distancing, and we were wiping surfaces, as Dana was talking about. As we've moved into this phase, we had some pretty significant surges in the schools, much more significant this year than we had in the earlier versions, if you will, of the virus. So we didn't experience a lot of stuff the first year or so. We really started to see a big uptick this year when we had Delta and then Omicron. And so concurrent with that was a push out of the California Department of Public Health to get testing going on campuses. And that became a powerful tool for us as we were able to use that to identify kids who maybe were asymptomatic. We tested athletes is what we tested, because that was really one of the guidelines is to, if you're going to do extracurricular things, you need to test for that, because we had kids who were, either unmasked or just in more close contact. And so that really revealed a lot of cases for us and allowed us, sadly, we had to exclude kids during that stage. But it did allow us to have at least some kind of grip on things, and keep it from us having to get to the drastic step of closing the whole school. So we never really had to close a whole school during this phase. So even at the height of our cases, we weren't closing schools, because we were able to use masking, isolation, quarantine, and all supported by testing, and then supported, of course, by all of you at Public Health and our school nurses working together to keep the campuses as safe as we possibly could. And we were fairly successful at that. As the guidance has changed and lifted, and masking first went away for the general public, and then became strongly recommended as opposed to required at the schools, we went ahead and made the decision in consultation with Public Health and with our nurses to go ahead and lift that requirement aspect and go ahead and accept the strongly recommended. And we do have a few people who come in masks, and we have some people who are really conscientious people who are paying attention to these rules, and if they think they've been exposed, they mask, or if they feel they have a family member at home and they're vaccinated, they'll mask voluntarily. So that's the kind of stuff we're doing to mitigate things. And really, it's drifted into more of a we really look heavily at symptomatic kids and adults right now. That's who we're really looking at mostly. If we get word of or get a request, somebody wants to be tested, we're happy to do it. We still have Binax as the main test that we have been using. We still have a great quantity of those. We're in great shape on stock on those. And we also have home tests. And I think, Zach, that might come up in another question, so I won't touch on home tests right now. But those are the kinds of things that we've been doing to keep things better in the schools. And we've had success. Our rates are really low right now. We're starting to see a few additional cases beginning to show up. And our partners with Public Health are really helping us look at that and making sure that we respond quickly and adequately to that, so that we hopefully keep it tamped down and we don't experience a surge like we did back. I guess it was just a few months ago, but it feels like almost a lifetime ago now. So
great, thank you for that, Kevin. Yeah, no, it's definitely been an interesting year with schools, and we were really excited to see that, in fact, you had not closed any schools completely. So really, thank you, Kevin, for your dedication at the school district. We do have one more question in regards to the vaccine mandate for schools. It's been out of the news quite a bit lately, and so we're curious what's been going on and what you've heard. Dana, you might have something to say on this later on, but please, Kevin, go ahead.
For sure. So I we've been paying very close attention to that. And when I say we, I mean not only us at PUSD, but just basically the community of educators around the state. So I'm heavily involved in special education. That's kind of one of my focuses. And so I go every couple of months to meetings in Sacramento with other people who are kind of Java-likes of mine around the state, obviously from much larger communities.
Right.
So they're particularly concerned about the mandate, because most of us in education are concerned that if the mandate does not allow carve-outs for people to have a personal belief exemption, we understand the importance of everybody being vaccinated, and yet we're faced with a reality where we have children who may not be coming back to school if that is the case, and we worry about. Of course, education is our primary focus, so we're concerned about not having kids at school, and we're also concerned about COVID. But at the same time, we're concerned about kids not being at school. So it's very challenging for us as educators to be able to sort of thread that needle, and it's not an easy choice for us. At the same time, we support kids getting vaccinated, obviously, and we think that's a really important part of the public health response. And yet at the same time, also, we want those kids at school, and we also want our employees to be at school. And so really, what people are looking at right now as things move through the legislature is whether or not a particular bill is going to move forward. Right now, the carve out for personal belief exists and will be maintained unless it's changed through legislation. And there's a law that's moving through the legislature right now. We don't know what's going to happen with that. People have their crystal balls out, but that doesn't mean that they really are knowing exactly what's going to happen. So that's the most I've heard on that. I'm not sure exactly where that is in the legislature now, but I'll probably find out at the end of this month when I go back to Sacramento.
And Kevin, just to jump on that, I've been answering a lot of questions like this in the clinic as well. My understanding is that the vaccines won't be mandated until they have full FDA approval for children. Is that correct?
I believe that is correct. Yeah.
That's the intention.
Yeah.
Yeah, I don't have any other information about that bill moving forward either. It may have lost some momentum recently, but we'll see.
Yeah.
Great, thank you guys for that. One more question related to the school. Maybe this is Dr. Satterfield and Kevin. But it's a question asking if there's any difference from the test that the school is using versus what's available to the public, or what you might find at Public Health or Rite Aid or something like that.
Well, it's, I'll tell you just my experience is, and it's not as technical. Dr. Satterfield will be able to speak much more to that. But if from my perspective as in the schools and as a consumer, I was able to buy the exact same Binax test kit that we're using at school at the Rite Aid pharmacy in Reno, and it was precisely the same. Only instead of coming in a box with a dropper bottle for the solution, it comes with a single use solution in the commercial kit. So the tests. The tests are very accurate for our purposes and have been working out really well for us. There's obviously some times where there's anecdotal situations where we get a test result that just doesn't make sense, and we work around that. The other tests that we have gotten are also antigen tests. They come from two different vendors, and these are at-home kits that we've sent home. Over the Christmas break, we sent home iHealth branded kits, and they were little 2-packs. Really essentially exactly the same as what you get at the store. They were also shipped to me when my wife filled out the form online, and the federal government shipped us those exact same kits. So they're really all the same. My knowledge of the manufacturing processes associated with antigen tests, which I did in another life before I was a chemist before I was a teacher. And during that phase, I actually did manufacture those kinds of tests, and the way that they're made and controlled as medical devices is exactly the same, no matter what their final intent of use is. So there's no difference between the way that a Binax test intended to be used in a hospital is manufactured versus the one that you buy for use at home. At least that's my understanding. And so we feel confident in the use of these tests, and we'll be sending more home over the April break with our staff and students so that they can test at home if they wish before they come in to school, so that we can hopefully keep positives off of campus when we come back from the spring break in 2 weeks, because we anticipate there'll be a lot of movement in spring and people are ready to travel. So
yeah, the ready availability of these tests is really, really important to managing the pandemic. And it's so fabulous that people can test themselves at home and that our schools have wide access to them. We've scientists look at tests in terms of sensitivity and specificity, which basically means if a test is really sensitive, it may only may only miss one person in 100 that actually has the disease. And the PCR tests, like are done in hospital laboratories, are 98, 99% sensitive, and the antigen tests are maybe 90%. And those are round numbers, but that gives you some idea of maybe the difference. And then the specificity is just the flip side of that coin. You know, if the test is positive, do you really have COVID? And antigen tests can fail us a little bit there too, because there's lots of coronaviruses in the world that are not COVID. And so sometimes they're fooled. But there again, the numbers are small. And so I go back to the analogies I was telling someone earlier today. You know, it's a lot like a pregnancy test. You know, the ones you get at the dollar store, you get at the pharmacy. You know, if a woman feels like she thinks she might be pregnant, you know, and has the right signs and symptoms, she goes and gets the test. And if it's positive, chances are very extremely high that it's all right. But let's say that she feels like she might be pregnant and the test comes back negative, you know, well, what's she going to do? She's probably going to go get another test in a day or two and test again, or she might go to the hospital and get a hospital laboratory test. And I think our COVID test can be looked at in a very similar vein. And during that couple of days between tests, you know, she's not being crazy. She's being careful to eat well and be healthy, because she might indeed be pregnant. We would ask the same thing of a person who about their COVID test. But it's been a sea change for all of us, and it's so great to have the schools able to test any child now that comes to school that has a new runny nose and we can't explain it. You know, they're going to get a test, and it helps keep our schools safe. So I don't know any particular questions, but
one other comment on that too is that the home tests are really powerful, because what they let us do is shift responsibility from the government to individuals to test themselves and do the right thing if they test positive. And so, you know, that's really much more powerful and better in terms of individual responsibility than having the government try to impose quarantine and isolation on people.
no doubt.
Okay, well, we're running short on time, but I have one more question that I'd really like to get out before we open up the Q&A, and that's regarding treatments. We've had a lot of changes, and so some of our questions, you know, were like, well, what do we even go off of now if we have these changes? So Dr. Satterfield, would you mind talking a little bit about the treatments that are available and how somebody would go about getting them if they were to do like a home test or something?
Sure. So we've been really excited that the treatments that have come out now are highly effective, and they seem to retain that effectiveness across the different variants of the virus as well. So unlike the vaccines, which seem to have lost some of their effect in some cases, these treatments I think are going to sustain. It's important that they be initiated though within 5 days of the person's first symptoms. And that's really the trick, because, you know, the average guy who's 65 and never thought COVID really existed and has a few symptoms, he waits 3 or 4 days before he gets the test, before he calls to get a test. And then the hospital may say it's going to be 2 days to get tested. We want him to go get a test at Rite Aid or Quincy Pharmacy and get tested right away. And then it's important that they have to get in to see a provider to prescribe the meds. And all of that has to happen within 5 days of the first symptoms. And so the biggest part of this is that, and then really getting on those meds reduces the chances of hospitalization or death, again, by over 90%. And if that's a pretty high risk person as a doctor, if I have somebody who's say 65, didn't get the vaccine, maybe he has COPD or something like that, and that person gets COVID, they are really at some pretty high risk. Something bad could happen. And so we want them to get tested right away. And then if they test positive, and you get into a provider, and all three of our hospitals are working hard to get people into a provider who can make that decision. Often it's they will be seen in the car. They don't even have to come in the building, and they will make a good decision about whether or not. And I want people to know too, we're not trying to sell these drugs. If they don't need the drug, that's fine. And we're not mad about that. But it's our job as providers to give them a good, intelligent, science-based decision about what's a good decision to make. But yeah, we need them to know, get the test, and then come see a provider.
Great. Well, in an effort of both time and kind of, moving forward here, we are finishing the hour that we had set aside for this. So we'd like to open up the floor for about 10 minutes. If you have a question, we'd ask that you raise your hand. And again, please keep it to a question and less than 1 minute long for your question. I was told a good presenter always waits 7 seconds. So we're going to wait, make sure, and by all means, I know that a number of people on this panel also really enjoy talking, and so I'm sure that we could find something for each of them to talk about the last little bit. Oh, here we go. Erica, you have a question.
I do. I'm considering getting a second booster. I'm over 50. But I'm also thinking about the timing, and I'm thinking to move it closer to the fall when we'll be congregating inside more. What do you guys think about that?
I see a lot of nodding heads.
Good question.
Yeah.
We'll let the doctors answer that one.
I think that's a good idea. I also think we don't, like Dr. Satterfield said, we honestly we don't really know right now.
Yeah, so we're seeing a few extra cases in one part of our county. Makes us wonder if the BA2 variant is getting more of a foothold here. We don't think it's more severe, but seeing more cases it's what we see before surges come, and we don't think too much. But one point I'll make as well is it seems like the immune response is much more abrupt when people get a booster. So there probably would be time, if we start to see some variant circulating in San Francisco and Sacramento, there's probably time to get that booster. And one of the experts on virology, nationwide, also pointed out that sometimes there's some thought that getting too many boosters may decrease their activity over time. So I would say I agree, save it.
But also don't forget to talk to your primary care provider. If they're on this panel, then you've already done your due diligence, Erica. So we're good there.
Absolutely true. Absolutely true.
Any other questions? We'll wait.
Yeah, I have a question. I don't know how to raise my hand. But my question is, why is it that all my friends who are getting the vaccine and the boosters are all getting sick? I just want to know why they're getting sick, because I have a lot of people in my life that are being ill affected by this vaccine that is targeting their immune system and they can't recover.
Do you mean getting ill with COVID or getting ill with side effects of the vaccine? I don't know if I can hear. I think she's talking about side effects of the vaccine.
That's what I thought.
And I will say that in my large patient population and having been taking care of people who've been vaccinated now for well over a year, I am not seeing any kind of trend of people having any kind of long-term ill effects from the vaccine. Healthy people have a good, robust immune response to the vaccine, so you can feel pretty yucky for 1 to 2 days after the vaccine or the booster. But I tell people that's a good sign. It means your immune system is reacting and making antibodies. And the hundreds of millions of people that have been vaccinated nationwide, we're not seeing any kind of trend towards harm with this vaccine or any cause for concern.
Well, we're sure seeing a lot fewer people go to the hospital if they're vaccinated. or die. I mean, so they're, even though they're not perfect, it's like the car seat or the seat belt. You know, it's not perfect, but it does decrease the deaths and the bad outcomes, to our understanding and knowledge. We appreciate the question, though.
Time for another couple of questions. Well, if there's no more questions at this time, we can go ahead and wrap this up. I do have a couple announcements that I wanted to make, so don't jump off just yet. Number one is that this is recorded and will be made available. We'll be reaching out to those of you that have asked questions, just to make sure that that's okay from that end of things. On the flip side as well, any questions that don't get answered or that might have come up, then we're going to be continuing this in a rolling basis. So keep updated of where you can submit
I
your
want to
questions.
ask whether you've entered anything into VAERS, and I need to know about the reporting that you're doing, because I haven't heard that you're doing any reporting or participating in that system.
Well, I for one have made a VAERS report that had to do with an administration of a medication that had a side effect that needed to be reported. So I for one am quite familiar.
Yeah,
And
I am as well. I have not reported anything to VAERS yet because I have, for COVID, I haven't seen any severe reactions, luckily. But I'm well aware of the VAERS system and how to use it.
And I'll also mention from our side here at PCPHA, we take VAERS very seriously, and anytime that something would qualify, whether it's for COVID or some other vaccine, we take that very seriously and do report that right away.
So how right away is it that you report it? Because I haven't heard that you've even trained your people to report it.
Jen, that is a regular thing that is done. It's sent into the federal government and they handle it from that point on. So it's just about the reporting aspect of it. Quite often that's done within any of the electronic reporting systems, or it's automatically, or it's, you know, a separate report sent in, but it's not as if it's something completely different. It's a very direct form that must be filled out if you are wanting to keep your license at your facility. So that happens on a regular basis, whether it's a clinic that we're doing here on campus, or if it's a clinic that we go out and do into the community. We report all of those things that come through us that we are made aware of.
And like I said earlier, it's been a really important tool. That's how we learned that people were getting myocarditis and getting blood clots. To that extent, it's working.
Any follow-up to that, Jen? All right, I'm going to take that as a no, and we're going to go ahead and wrap up. Again, this recording will be made available on our YouTube channel. And secondly, any additional questions, you guys all have access to that COVID-19 at countyofplumas.com. Please feel free to ask questions. We're going to be following this up with some regular updates with some of our participants and other participants that were not able to make it this time to be answering those questions for you on a regular basis. So we encourage questions and we'd love to hear from you. We thank you for attending tonight, and we hope to see you the next time that this would happen, if that is called for. Again, if you have any follow-up after this or want to talk about something, please reach out. Again, that's COVID-19 at countyofplumas.com. So thank you guys so much for your time this evening. Thank you, panelists, for your after hours. And I hope that you all have a wonderful evening and look forward to a great weekend. So take care, and we'll see you next time.
Thank you.
Thank you.
Thank you.
Good night.
Thank you. Good night.
Good night.